Congrats on making it to the last video. And this is the one that's probably the most applicable to most patients. We're discussing everyday living after surgery. All right, let's start at number 1 here. When can you shower? So you can shower right when you get home. Now the major question though is, are you going to shower with or without that pouching system in place? Some people choose to do it with it, other people choose to do it without it. They're both okay. It's okay to have contact with soap and water. It's not going to harm your stoma. You don't need to worry. Now, when it comes to bathing or swimming, we ask that you wait 2 weeks just to let things heal a little bit more. But showering, a-okay. All right, question number 2. Do I need special clothes? And actually, you can wear almost anything that you want. Anything you wore before the surgery, you can wear after the surgery. Other people will not be able to see your ostomy bag underneath your clothes. Do not worry. Now, there are some circumstances in which you might want a little extra support for the ostomy bag. Let's say you're exercising or you're swimming, or there are even certain bags for intimacy. In those cases, you might want something special, and you can just go online and do a Google search to see what's available. Now to activities. What activities can I do? Well, again, anything you did before the surgery, you can do after the surgery, but you got to work yourself into it. It takes a little bit of time. So as your strength returns, you can go back to your regular activities. How about walking? Well, you might be surprised to find out we actually encourage walking starting within 24 hours after surgery. That early. Climbing stairs is okay as long as you're steady on your feet, and really just gradually build up into things. The only thing to remember is maybe at the beginning, avoid lifting really heavy things. For the first, let's say 4 weeks, you might want to hold off on lifting things heavier than a gallon of milk. All right, number 4. This is the question that many people have, but some are afraid to ask. Can I have sex? And unless you've had vaginal surgery, there's no reason that you can't have sex. But use pain as your guide. If it hurts, don't do it. Now there's some tips and advice we can give you, and that is you can consider emptying the pouch before starting to have sex, and that's just to avoid any accidents or any spills. And it's important to talk with your partner and let them know what's going on. And if you're having anxiety, communication is really one of the best things there. Now, if you're conscious or self-conscious about the pouch being between you and your partner, you can consider side-lying positions for sex. And remember, of course, safe sex practices. Now, I'm by no means an expert on intimacy after ostomy surgery, but the United Ostomy Associations of America has put together a guide focused specifically on this topic. And if you're interested, you can do a quick little Google search, and that'll pop up for you. All right. Now, number 5. Maybe less exciting than number 4. When can I go back to work? You should expect to go back to work in 2 weeks. And the timing of your return depends on the type of work that you do. So if you're doing heavy, strenuous work, let's say you're a police officer on the streets, you might want to give yourself a little bit more time than, let's say, you have an office desk position. Now, 3 warnings that we need to tell you as you go back to work. Number 1, if you are using prescription pain medication, don't drive or use heavy machinery. That's a big no-no, and it's very dangerous. Number 2, when you do go back to work, remember that you're going to need access to a bathroom at work to empty your pouch. Now, number 2 isn't mandatory. There are ways around this, but it will help you a lot to have access to a bathroom. And number 3 is just more of a tip or advice, I should say, and that is to remember to bring an extra set of ostomy supplies with you when you leave the house. And here's some patient advice for tips on leaving the house with an ostomy.
Well, what I do is I always have my travel bag, and I just keep that in my car. This is specifically for ostomies. You can find them online, but you can also just use a little travel bag, like for a makeup bag or something, and just put your supplies in there. But what I do is I have an extra bag and a wafer in there, just in case you have an accident. And sometimes the wafer, for whatever reason, might just come undone, unsealed. And once that breaches and the stool comes out, you have to change the whole bag. It doesn't happen very often, but it's nice to have an extra set with you, because you cannot buy this at your local drugstore.
All right, the question that's going to affect you 3 times a day. What can I eat? And what I'll do is I'll bring that question back to you. What can you eat? Really, anything you ate before the surgery, you can probably eat after the surgery. And anything that bothered you before the surgery will probably bother you after the surgery. Every person is different, so trial and error for many foods. And remember that no food is absolutely to be avoided. So what should you do? Add new foods one at a time. Do it in small amounts. See how your body responds. If you handle it well, awesome. If not, you know what it is. But if you add a bunch of new foods together and then you don't feel very well, it's hard to differentiate what caused it. And remember that digestion begins at the mouth. So chewing is very important. Not only will it help prevent blockages, but it improves digestion and absorption of vitamins and nutrients. And don't forget to get your 2 liters of fluid in a day. All right. The last part here is some basic food problems and solutions. And the reason I bring this up is that time and time again, there's certain foods that do certain things to your stool or to your intestines, and it's helpful to know what those things are. So let's say, for example, you have looser stools and you want to try to thicken your stools. Well, what's one food that might thicken your stool? Bananas. Now let's say you're worried you might have a blockage, or you're having really high output and you want to avoid eating certain foods. Well, if you do have high output, or if you have a blockage, you might want to either avoid prunes or eat prunes. So prune juice people typically use when they're worried they have a blockage. But if you had really loose stool, you'd want to avoid foods that are going to loosen your stool even more. Does that make sense? All right. Without a doubt, you're going to experience some point where you're going to have, gas in your pouch, and you're going to have to empty it. And there's certain foods that are associated with increased gas, and these occur for people with or without pouches. Beans is a big one. Also broccoli or Brussels sprouts or cauliflower. These are some of the harder to digest foods, and they can cause that increased gas. Milk and dairy, for some people that's a big problem. For others, it's not as much. And finally, there's some foods that might block your stoma. Typically, these are the hardest to digest foods, like popcorn, dried foods, fruits, foods with skins, celery, really kind of stringy vegetables. And finally, let's just spend a second to talk about adapting to life with a stoma. For some people, you're not going to skip a beat. You're going to have so much pain and irritation before you have the stoma that once you get it, you're going to breathe a sigh of relief. For other people, though, it can be difficult to adjust, and that is completely understandable. There's a lot of lifestyle changes that go along with having an ostomy. And my point here is that it's completely normal to have different feelings than other people. You might feel sad or even depressed. But if you feel this way, do try to get help. There are local ostomy support groups, which I highly recommend, because it gives you an opportunity to talk to people who've gone exactly what you've gone through and are there because they want to help other people. And another resource that I recommend is actually another video, and it's made by the United Ostomy Associations of America, and it's called Living with an Ostomy. And the link we've listed down there as well. All right, that is all. I really enjoyed being here. Hopefully you learned something, and remember, if you have any questions or if anything was confusing, feel free to talk with your doctor and let them know what's going on. All right, take care and be healthy.